Intake and consent forms just got a lot smarter. Now RX photo forms sync directly with PatientNow Essentials. So you can come in and edit any of your previous templates and add these EMR fields that are mapped to PatientNow. So you can add medical history, demographics, and insurance information. Insurance information is only available if you have labs activated. Here you can see the demographics section and medical history. After you hit save, this will create these new forms that you can send to any of your patients. And when they fill out these fields, it will automatically update in PatientNow. Let's take a look at what that looks like in action. To send these forms out automatically, you can attach them to certain services. So let's say every time I do a toxin consult, I want this pre-treatment Botox intake packet to go out. I can set that up here. And I can also set up post-treatment. So let's say every time I do a toxin treatment, I want to send out post-care instructions. I can set that up here as well. So let's head to the schedule. Here you can see Bella has a consult. So it sent out her intake and consent forms automatically. Here you can see two icons that show that they still have some open form packs and their forms need review. Once they complete the forms, those icons go away. So this means your front desk always has visibility into which forms still need to be reviewed or are incomplete before the appointment starts. After the client completes their forms, whether they do it by text, email, or in the office with you, it will automatically map into two key areas. So the first place it'll map is in the client details. Here you can see it pulls in their phone number, email, and their demographics. So things like their birthday and all that, and address if they fill it out, as well as insurance if you have labs enabled. If there are any fields that don't match, so maybe let's say they put a phone number in that doesn't match the one they previously had, it will trigger you and let you know that there's a discrepancy for the provider to review and approve before it changes the record. The other area that it will update is the treatment record. So here you can see that it'll automatically pull in all the information that the client filled out in their medical history. This means that your front desk staff doesn't have to go in and copy and paste things into the client record, and your provider gets a jump start on their charting. These enhancements save time, reduce errors, and keep everything perfectly in sync.